Good afternoon, everyone. Good afternoon, everyone. On the behalf of Holy Family College of Nursing, in collaboration with ANEI, I would like to welcome you all for this international webinar to celebrate World Mental Health Week. And for the theme for this year is Make Mental Health and Well-Being for All a Global Priority. Now, I like to invite our principal and Dr. Aminder Kalra. She's graduate, postgraduate, and PhD in nursing. Madam has 37 years of experience in nursing field. Madam is a founder principal for Holy Family College of Nursing, and she's a recipient of Gold Medal President Award. Madam is also Vice President of ANEI Delhi chapter. Welcome, ma'am.
Thank you so much, Arshi. Nice to see you all joining. When we talk about mental health, I think during COVID-19 time, a lot of people had started giving a lot of importance to mental health. We all know that mental health is an important component of our physical health, and a lot of physical disorders are caused due to mental health issues and vice versa. Mental Health Day is celebrated worldwide on 10th of October each year. And this month is celebrated as Mental Health Week. This day provides us with an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done in the field of mental health. As I said, COVID-19 pandemic made us all realize what is the importance of mental health. There were people who were affected with the physical illness of COVID, but I think each and every person has gone through some or the other stress factors and mental health issues related to COVID-19, whether they were working as frontline warriors or they were sitting at home during the lockdown period, losing their job, and so many other things which have caused a lot of stress. Even before COVID-19 pandemic, the mental health issues have been a major concern. Before 2019, 1 in 8 people globally were living with mental disorder. At the same time, the services, skill, and funding available for mental health remains in short supply. Estimates are there that with COVID-19, there has been 25% increase in cases of anxiety and depressive disorder and many other mental disorders. At the same time, during COVID-19, the mental health services were disrupted and there was a treatment gap. Growing socially and economic inequalities, talking about the violence, public health emergencies, we find overall 84 million worldwide were forcibly displaced during the year 2021. And this is the time when all the stakeholders have to take up the responsibility across the world. We must strengthen mental health care so that the full spectrum of mental health needs is met and we are able to work on preventive, promotive, curative, and rehabilitative mental health services. World Mental Health Day is an important opportunity to do that collectively. WHO's theme of making mental health and well-being for all a global priority provides an opportunity for people with mental health conditions, advocates, government, employers, employees, and other stakeholders to come together to recognize progress in this field and to be vocal about what needs to be done to ensure mental health and well-being becomes a global priority for all. Keeping all this in mind, this webinar has been organized, and it's a proud pleasure for me that Holy Family College of Nursing, in collaboration with ANEI, that is Association of Nurse Executives of India, Delhi chapter, is hosting this webinar. We are thankful to the ANEI to provide us with the opportunity for collaborating with them. It's a proud pleasure to have with us for this webinar Dr. Deepika Khaka, who is the nursing advisor to Government of India. It gives me an immense pleasure to talk about Dr. Deepika. Dr. Deepika has taken up the post of Nursing Advisor, Directorate General of Health Services, Ministry of Health and Family Welfare. And when we're talking about mental health, she is a person who has spent 34 years in different capacities, working in nursing, working for mental health. She has worked for 34 years in AIMS. She has been awarded Amazonian of America Award of the year 1999 and Best Research in 2006. She has been awarded as top poster Evidence Live 13 conference at Oxford University, UK, awarded Purgatory Fellowship at New York University 2002 to 2003, awarded Advanced ARTRP Fellowship at University of California. She has been District Counseling Supervisor for ICTC, Master Trainer for GFTM, and is a national consultant, international consultant, and journal editor for a lot of journals. She also has a lot of research projects she has taken. She has been a research supervisor guiding 7 PhD scholars, 52 MSc nursing, and also 1 MD person. It's my proud privilege to have this opportunity to introduce Dr. Deepika. We welcome you, Dr. Deepika, a nursing advisor for this webinar. We also have with us our speaker, Mrs. Sangeeta Sharma. She has done her graduation and post-graduation from RK College of Nursing, and she has worked for 20 years as a nursing faculty in Delhi, and then also as an academic counselor for IGNOU. Then she shifted to Australia and had been ward in charge in Dublin at East Coast Mental Health Services from 2003 to 2005, and hospital coordinator for 116-bedded private psychiatric clinic for last 17 years, and she is still working. So to get an international scenario, it will be a proud privilege to hear from her vast experience, because she'll be able to compare what is happening in Australia, and she's well versed with the things which are happening in India also, plus Australia. We are also proud, we are also having the privilege to have with us our young psychiatric nurse, Ms. Nikita Sharma Karnam, who has done her studies in nursing from Australia. She's a master's in mental health nursing and certificate of teaching and assessment. And till date, she's working as credential mental health nurse and currently working as a senior mental health clinician with 6 years of teaching mental health to university students at Latrobe University. Welcome, Nikita. It also gives me immense pleasure to have with us Dr. Sai Lakshmi, who's the professor and head department of nursing consultant in psychiatric rehabilitation services, geriatric psychiatry, and adult psychiatry. She has received President Gold Medal, best article published in Journal of School Social Work. She is a recipient of Florence Nightingale Award from Karnataka, as well as the National Florence Nightingale Award by the President of India. She has also got Best Field Research Article Award by Swan and Natham, Dr. Radhakrishnan Gold Medal Award. She's a mental health leader, and awarded Aparna Bhadri Oration Award. We welcome you, Dr. Sai Lakshmi. It's proud privilege that you have been able to join us. And as a personal working in NIMHANS, which is a National Institute of Mental Health and Nursing Neurosciences, she is the best person to talk on what is happening in India, not only in the hospital setup, because NIMHANS has been a leading institution in community health nursing and community psychiatry. We welcome you, Dr. Sai Lakshmi. It also gives me proud privilege to have another speaker, Rachel, who has done her studies from India and is doing her PhD from British University in Dubai. She has worked as staff nurse and nursing faculty from 2010 to 2015. And then 2014, she migrated to UAE and she is a lecturer there presently. We welcome you, Rachel. Rachel also will be able to talk about what is happening now in UAE, because we have a lot of concerns whether it is really Mental health is an important component which is being talked about in these countries also. And now it is my proud privilege to have Madam Tangam Gomez, who is the President, Association of Nurse Executive of India. She is a very well-known personality with 38 years of rich experience leading to becoming an entrepreneur focused on patient safety and nurse empowerment. At present, she is actively involved in leadership development, nursing administration audits, risk management, infection prevention, and critical care training. Involved in various consulting and virtual course design, certified in high fidelity simulation, Green Six Sigma, distinguished instructor and master trainer. She is founder and CEO Signia Healthcare, and we all know that Signia Healthcare is doing a lot in online education for nurses, especially when we talk about patient safety, we talk about infection control and many other areas. She is a member of FICCI National Health Committee, recently inducted into the leadership also. And we welcome you, Madam Tangam Gomez. It's also my proud privilege to introduce to you Captain Sandhya Shankar, who has 26-year contribution to military nursing, industrial and corporate and healthcare quality assurance. She is BSc Nursing from AFMC Pune, and she has done MBA Healthcare Management, PG Diploma in HRM, Clinical Leadership, National University of Singapore, currently heading nursing services for Otis Group of Hospital and President, India Delhi Chapter. NABH and NABL Nursing Excellence Faculty and Assessor. She has served as Director Nursing Medanta City, and she is the one with a lot of experience and has contributed even as co-author in CBSE curriculum, book and 8 scientific paper publication. Distinguished and well-recognized award holder in field of military nursing, industrial, corporate, and healthcare, a well-known personality in India. We welcome you, Captain Sandhya Shankar. Now, may I request Madam Tangam Gomez to give the presidential address. Madam Tangam Gomez, please.
Thank you, Dr. Raminder, and good afternoon, everyone, and namaste, and good evening to all our experts from outside India. Thank you so much. Maybe I can request Arshi to stop sharing the screen, please. Thank you. Arshi, can you? Yeah, thank you very much. Yeah, that's better. Then you're able to see more people on the screen. So good afternoon once again and good evening, everyone. After hearing all the introductions, I feel I'm the least qualified to talk about mental health. I will say I am qualified to talk today is only because probably I have more experience, 40 years of being a nurse, and 40 years of managing nurses of different age groups. Whenever I think of mental health, I know there is a large domain of mental health in the community, but there is a need to look at the mental health of nurses. It came to forefront during COVID, of course. The mental health of caregivers became a top discussion and research papers. Many are coming out even today. But while I reflect on my experience as a nurse, when I was a bedside nurse, I don't remember any of my leaders ever discussing with me if I'm okay. Are you okay? Have you gone through a tough time, or you had tough time in the hospital, or you had managed more patients? How are you feeling? Seldom. But I have my, my family members working in other industries. There, if anyone says that I am having anxiety, I'm having anxiety to do my job, immediately the person is, referred to their counselor, and they have to spend time with the counselor. So now in nursing, if someone says that I'm feeling anxious because I've not looked after a patient like this before, what would that leader respond? I keep on reflecting about that. In all probability, the person might turn around and say that you haven't looked after such patients before. How many years experience you have? Where did you do your nursing? This could be the response. So I am more concerned about the mental health of the caregivers who are supposed to be helping community and patients in their mental health. So I really hope that some of you are going to throw some light on that aspect as well. Because if caregivers are not mentally healthy, if they are not able to manage their own stress, will they be equipped enough, even if they have knowledge, will they be able to do justice to the patients that they are supposed to give care from the mental health point of view? So there are many of you have got, excellent, experience in mental health. I'm so happy to see all the, esteemed speakers today, and I congratulate Dr. Ravinder to bringing so many people from that specialty to speak in 1 hour. I'm looking forward to listening to all of you. And without much of ado, I'm just going to say thank you so much to Holy Family Hospital, and thinking of making it a collaborative event for this with Association of Nurse Executives India. And those who are not knowing what ANEI is about, ANEI is a very young association of nurse leaders, which started in 2017. And by 2022, we have done a decent work around for nurses and nursing in India. And our mission in one line is only one: empower nurses and nursing in India, and to make the future for nurses in India better. And all the nurses who are here today, they all are from India. So I'm very sure that you have a lot to contribute. And I request to Dr. Ravinder only one thing: as president of ANEI, I always make sure none of our conferences or any activity goes without an action plan. There is something that happens after the conference. It is not all about talk, and then we go out, It does not translate into results. So I really hope today Dr. Ravinder is going to decide, and Delhi chapter is going to decide, that we are going to take away something from all our esteemed speakers' experience and do something, and probably for our nurses. With that, all the very best, and thank you from my side to all our esteemed speakers. I definitely know Dr. Sai Lakshmi, and I did tell Dr. Ravinder, there is one nurse who has done so much of work in mental health. I will always think of only Dr. Sai, very passionate person. And I'm sure all the other speakers here are equally passionate about the specialty you have chosen. So thank you so much for being here, and all the very best to Holy Family, Dr. Ravinder, team, and everybody else. Thank you so much. All the best.
Thank you, Madam Tangam. And yes, I know now none of the nurse administrators can work without looking into the psychological aspect. And I'm sure Madam Sandhya Shankar is going to agree. I can see a broad smile on her face. Madam, we'd like to hear a few words from you also.
Thank you, ma'am, and thank you very much for inviting me to this forum. And but most importantly, with having such stalwarts from the field, it's not about I feel great. I'm actually humbled, but I'm so proud to see such talents in nursing associated directly, indirectly with country and Indian nursing. And I take immense pride are having such talent and such resources here. And ma'am, to all the esteemed speakers, this is one thing. I'm coming from the operations, from the actual battlefield with the fleet of 7,000 nurses spread across the country. In my organization, one thing for last 3 years, which has started to become quite evident, which did exist but was never recognized, was nurses living and working with guilt and being the second victim for all types of, be it escalations, be it the negative escalations, be it the incidences, the clinical reports, or actually with the guilt which is missing out on doing what they wanted to do, what their patients deserved, and failing or maybe not being able to deliver the way they wanted it to be happening for their patients. So these two things, being the second, living by being the second victim, living with the guilt of not being able to fulfill the expectations or the desired actions, is something which actually goes as a very high and heavy burden. among the nurses. Rather, I would look forward to the sequelae of such sessions and would literally partner with Dr. Raminder to take it forward, that if we can help, because our fleet really needs guidance and tools for self-help. And Madam Sai, I had a brief connect with you over the WhatsApp, but somehow we could not connect again. But I'm so glad to see you here. And of course, Dr. Deepika and the younger ones. Glad. And I'll eagerly look forward to listen to you now without taking much time. I would rather, focus on picking up my pearls of wisdom, my bits of experience and the expertise, as well as the suggestions from your conversation, from your talk today, to take it back home to my teams. Thank you very much for having this opportunity. Partnering with Dr. Raminder, I head the Delhi State for Association of Nurse Executives India. And this is what, out of our roles in the hospitals, we try to contribute and do our bit to the nurses in the state and in the country. Thank you so much. Thank you for obliging. Back to you, Dr. Raminder.
Yeah, thank you, Captain Sandesh Shankar, for highlighting on, as a corporate leader, what you have, the vision. Now it's my proud privilege to invite Dr. Deepika Khaka, and I really feel proud of that we have a mental health nurse sitting on the topmost position of the country, and we know that she'll make it, the mental health, heard by everyone in the ministry. Over to you, Dr. Deepika. We would like you to hear from you as a person with vast experience in mental health nursing. What are some of the issues and concerns related to mental health services in India? And what, as nursing advisor, you would like to take up to the ministry and putting the plans into action? Over to Dr. Deepika. Madam Deepika, you need to unmute.
Good afternoon to all of
you.
Esteemed panelists, Dr. Raminder Kalra, and the dear participants of this webinar. I would like to congratulate ANEI for holding up this program on the occasion of the Mental Health Week, which we are celebrating, regarding the theme which has been given by the World Mental Health Federation, like making mental health and well-being for all a priority. As Dr. Kalra said, thank you, ma'am, for your kind words, that mental health is a very important component, and during the recent times it has taken momentum, and people have started to realize there is a sensitivity thinking that mental health is a very important part and parcel of our lives, which needs to be addressed. And generally speaking, because of the lack of awareness and because of stigma, people were not coming out and asking for help, and they were suffering in silence. But with this recent lot of information on social media, people coming out, celebrity coming out and talking about their challenges which they face or their mental illnesses which they face, there is some amount of destigmatization which is taking place, and people are coming out forward and discussing and seeking help for their mental health issues which they are facing. And as Dr. Kalra was mentioning, the pandemic took a major toll on our mental health. It has affected each one of us in some way or the other. It affected children because they were not able to go to school, they were not able to socialize. It affected our economy, and because of this, there was a cascade of repercussion in different domains in the life of people. And speaking about the huge magnitude of mental illnesses, that there was a survey which was conducted by the National Mental Health, which was a national mental survey in the year 2015 and 16 by the Ministry of Health and Family Welfare. And there was also a national survey which was conducted by the Ministry of Social Justice and Empowerment. And the report of these surveys reflected that there were the psychiatric morbidity was 0.8%, and 0.8% of the population had severe mental illness, and out of which the reports reflected that there were 2.9 crores who were dependent on alcohol, 2.5 lakhs were dependent on cannabis, 28 lakhs were dependent on opioid, 7 lakhs were using inhalants. And as per the National Crime Records Bureau, in the year 2019, it reported that there was suicides were reported, which were 1,39,123. And in the year 2019, the suicides were like 381 suicides per year, which escalated to in the year 2020 to 418 suicides per day. Now, this shows the quantum of mental illness which we are facing. And this is reported. There may be a huge, substantial amount of data which is missing because it is not reported. Mental illness is highly unreported because most of the people don't come for help. So they don't figure in the statistics or in the data. So as Dr. Bukalra was also mentioning, that anxiety and depression are one of the significant mental health areas or mental health problems which the population is suffering. And because of this, the repercussion of the anxiety and depression leads to global years lived with disability. And this disability is in terms reflected by the data reflects that 12 billion work days are lost every year to depression and anxiety. And we know that in India, during the lockdown, there was a disruption in academics, there was economic loss, which impacted people in all strata of the society. And the economic loss was associated with mental health issues. And this basically revolved around a vicious cycle of comprising of poor education, poor parenting, uh, risk-taking behavior, substance use, stress because of the loss of finances, unemployment, and domestic violence. And depression and anxiety has increased globally by 25% as per the WHO reports. And the treatment of depression and anxiety needs to be scaled up, and workplace should be more conducive and more mental health friendly. So we have to do certain things from our side to improve the work environment. So the environment is conducive. And as Dr. Gomes was saying, that our work environment, if it is conducive, naturally the quality of care the quality of services which an individual is supposed to be rendering will be of optimal quality if the work environment is conducive. So in our own areas, in our own workspaces, we should try to do some intervention to build up conducive environment. Have some kind of thing that we are able to promote mental health. Have little activities to promote mental health. So this is an important area which needs to be taken up. Like the other day, I was talking to the mental health division head, and I was telling us, let us start something here in the ministry also. A kind of a counseling cell or something or some activity we can do so that the stress and the work pressure is being taken care of, and people are in the in hemostasis. They are able to function at the level they are required to function and able to handle their daily pressures of life. So we have to do some things at our own personal level, as we were discussing, that only if we are in mental hemostasis, we are at peace, we are happy and healthy, then only we give the services which are expected out of us. If we are under extreme pressure or extreme stress, naturally our quality of work which is expected out of us is going to be compromised. So as a saying goes, charity begins at home. First we have to invest in our own mental health, take care of ourselves, then only are we competent enough to give services which are expected out of us. So in our own specific way, in our own special way, we should do something at our own workplace to begin with, and then start thinking about, as a professional, as a healthcare professional, in whatever capacity we are working, what is our contribution in rendering those services related to mental health which is expected out of us. So when we talk about the various issues which are required to be addressed in relation to mental health, is we all are aware about stigma. Stigma is one of the biggest deterrent or obstacle. It is one of the most important obstacle which needs to be addressed. Because of this, people are hesitant to approach any mental health facility if they are even having some kind of mental illness. So what we can do in our own ways is to address stigma is increase awareness. Now social media is a very powerful, which is available now. We can we can address and inform and clear myths and misconceptions of people regarding mental illness so they can come forward and take help and not suffer in silence. Then literacy, we have to improve literacy of mental health, increase awareness generation, then availability of psychotropic drugs, accessibility of mental health. Now, we all know in our country, there is a lot of skewed ratio between the psychiatrist and the population. Like as per the data, there is 0.75 psychiatrists available per 1 lakh population. So prevention is better than cure. We can do some activities like promotive, mental health promotive activities so that we are able to prevent people from getting illness. Small things like, awareness in the schools. Nowadays, teachers are also very aware regarding, how to pick up behavior problems right from the beginning, where to refer, what to do, what support requires to be given to the child. So we can start right from the childhood and during the school, educate and sensitize the teachers and the counselors regarding what to do if the child is having any kind of deviant behavior. Then also we have to think about like addressing the access to right care, that the person, we have to propagate this information and tell that if anybody, it is not when you talk about mental illness. Another thing which I like to say is that the person with physical illness is also having mental health needs. When we talk about mental illness, we should not only think about patients with psychiatric illness, but we should also have the sensitivity that any person with any chronic illness or any person coming to any healthcare facility with any kind of physical illness can have mental health needs also. So we have to address the patient in totality and address the needs of the patient holistically. That not only take care of the physical needs, but also cater to the mental health concerns and needs the person has, and not treat the person with the physical illness will not have any mental health needs. So we have to have that kind of sensitization, that kind of awareness required to be generated to the healthcare team, that kind of sensitivity and empathy we have to deal with when the patient is coming to a healthcare facility. So we have to play a very pivotal role as healthcare providers and nurses in generation of awareness and in also creating kind of a conducive environment where we are working. Because only as a healthcare provider, if we are ourselves in balance, ourselves happy, we are able to render very important services which are expected out of us. Like Madam Gomez was sharing her experience that nobody asked me how am I feeling. So it is very important for us to have a very cohesive, a very strong team who is themselves supporting each other and taking up whatever task is given to them collectively and understanding that, yeah, we have needs too. So that kind of sensitivity is very important. Then we know that we are working towards attaining the SDG goals, and the 70th session of the UN Assembly in the 2015 had talked about the developmental goals, and this can be only achieved. One of the very important reasons is that when we are able to meaningfully invest in improving the mental health and well-being of our population. So that should be a very important priority, and I'm very happy that there is a change which we can see, and people are talking about mental health, people are taking some initiatives and carrying this forward, that is mental health is important and there is no health without mental health. So we at the ministry are also oriented and are geared and motivated to bring a change in this area as well.
Thank you so much, Dr. Deepika. I think you have touched a lot of points, rightly talked about the stigma, and we have seen how COVID-19 has affected. We are also seeing in our clinics that the number of autistic children have increased so much after this, and work environment definitely has to be very conducive. Happy to hear that you have already started working as a psychiatric nurse in your ministry also. Fine. And I'm sure that your message will be taken at a larger scale. Thank you so much, Dr. Deepika. It's a proud privilege to have you with us in this webinar.
Thank you for
now we move on to hearing from Madam Sangeeta Sharma, who has worked in India as well as has vast experience, almost 20 years working in Australia also. We'd like to hear from Madam Sangeeta that what are some of the mental health issues and concerns in Australia, and how accessible are the mental health services in community, in government as well as private setup. Over to you, Madam Sangeeta.
Hi, good afternoon, everyone. It's my pleasure to be a part of this webinar, and very nice to see the familiar faces. Hi, Deepika. I've seen you after a long time. And so I'm in Australia since last 18 years. So just want to give you an overview how the mental health support and facilities work in Australia for the clients as well as for the healthcare workers. So firstly, I'm trying to share my screen. And thanks, Raminder, for inviting us for this webinar. So to give an overall view regarding the mental health in Australia, it's like a bit different as compared to India, even though it's very small population. So the Australian population is about approximately 25 million. But the mental illness compared to the population is much more as compared to India, like 50, like it is, the data says like 50% over their lifetime, all Australians will experience a mental illness. 1 in 5, like it's about 20% will experience one or more mental health episode in their lifetime. 1 in 7 children aged between 4 to 7 will also experience mental health or behavioral issues. And the commonest one is ADHD currently. And nearly 2 in 5 of those aged between 16 to 24 had a mental health disorder in 2020 to 21. And the young women had the highest incidence of any group. The prevalent mental disorders which are in Australia are anxiety, that is social phobia, is the highest. It's rank about 16.8%, followed by depression, that's 7.5%, and the substance use or alcohol and other drugs use disorder is 3.3%. So these are the 3 main mental illness that are prevalent in Australia population. So every day, like I just want to give you about the suicidal risk, which is high in Australia. Self-harm and suicidal risk are very high. So every day, at least 6 Australians dies from suicide and 30 people will attempt. Like when it comes to the attempt, it's a cry for help. It's not like their intention to die, but the attempt is also very common here to seek the help as soon as possible. So they will attempt, not an intention to die, but a cry for help. Suicide is the second leading cause of death in young people between 15 to 25 years. Suicide account for, even though suicide accounts for very small amount, like 1.6% of all the deaths. Men being is the greatest risk and account for 76% of the deaths occur by suicide. 72% of the men, they did not seek any help and they suicide without seeking the help. So it is like very common here that men doesn't seek much help as compared to the women. And when it comes to the depression, depression is the #1 cause of non-fatal disability because here the government pays much attention to the disability. So depression is the non-fatal disability which is ranked high. WHO estimate that depression will be the highest concern in developed and developing countries. By 2030, it is the main concern. And women are more likely to express this to disorder as compared to men, as twice as high in women. The causes of mental illness, like as Deepika said, the main causes are, first is increased isolation, because here, according to the culture, they push their children out after 18 from the home. Like it is their culture. By the time the child is 18, they think it's time to leave the house. So most of the people live in isolation, even the elderly, like if you will find 70-year-old, 80-year-old people are living by themselves because the divorce rate is also high. So they are only the single person who is living in the isolation, which increases the chances of developing the mental illness, anxiety, depression. That's why it is more common here as compared to other psychotic or bipolar disorders. The stress, fear, anxiety, trauma, domestic violence, financial issues, negative family environment, because the divorce rates are so high and commonly about 50% of the couple has third marriage, like they already divorced two like wives, and they have the children, the stepchildren. So there is a family environment is not healthy as like in India. The family, the mingling of the family is not as common as India. So they feel like they are left out because the father will find a different partner and the mother will find a different partner. So that they are the child who can't survives in both ways, like either going with mother or going with father. They have to lose one of the parent. And the parental separation is also is the main cause here. Parental substance abuse, child mistreatment, abuse by the parents, and the foster care, because the foster care is also very common. When the mother has mental illness, father has divorced, gone somewhere, can't find where is the father. So the children goes to the foster care. So foster care also, they're changing according to the need, they keep changing the house. So their mental health is so much affected here due to this change of the house and the way they are dealing with the new parents, then again new parents. So it's become very difficult child to adjust in the environment. And the other causes include pressure of competition in the school, workplace pressure, bullying and harassment at work. So now if we will talk about the clinical mental services here, so there are acute, subacute, and the community support. So mainly I have divided into the main broad categories. So in the acute, there are mainly the public hospital. In the public hospital, we do have emergency department, but they have a separate psych triage. So anybody goes with any mental illness or in distress or high anxiety level, they are seen by the psych triage, not by the general practitioner in the emergency department. And there is a CAT team, crisis assessment team. It is the team which is there in every public hospital, and every population is aware of the CAT team. So if they are feeling a high distress in their home environment or in the community, they can call the CAT team. So it is the number according to the area which you live in. You can call the CAT team anytime by ringing the number of that particular area CAT team. So the CAT team personnel will come at your home, at the client's home, and they will assess that what level the client is, what type of care is needed. Is the client can be at home, and they will provide bit of reassurance if they think client doesn't need to be transferred to the hospital. So the CAT team is there. There is 24/7 supports are also available, like 000 line is there. There is a lifeline. There is a Beyond Blue is mainly deal with depression. So this is also 24/7 line. Anyone is in distress, can't cope, high anxiety level, they can call the Beyond Blue line. There is a suicidal call back line as well. So if somebody is suicidal and I don't know how to control their emotions, how to control their thoughts, so they can ring this number at 24/7 at any time. In the subacute, there are transitional residential rehabs. There is PARC, prevention and recovery care. So it is like a short term, the patient can be admitted into these units to minimize the load on the public hospital. And there is a PAPU, there is a psychiatric assessment and planning unit. Here the patient can stay up to 72 hours just to assess what type, like to triage, what type of services are needed for that particular person. If the person is having high distress level and it's unsafe to go home or to survive in the community, then through this unit, the person can be transferred into the public hospital for admission. And if they think the client can, now the distress levels have come down and they can survive in the community, they are safe for self and others, they can be transferred back into the community with the support systems in the community. And the community supports will be dealt by Nikita later on. So I work in a private mental health facility as a hospital coordinator. So most of the Australian, more than 50% of the Australians are having private health cover, and government do encourage them, everyone to have a private health cover. So the private health facilities are everywhere in Australia. the person has to take private insurance with a bit higher level to approach the psychiatric services. So the private mental health services, first is the GP. GP is the point of contact, like first point of contact, general practitioner. Every area in Australia is having GP. So the GPs, it's your choice which GP you want to go for. Like my area is having 10 GPs. So it's my choice which GP I want to. So some GPs charge to see nothing, some charge very small amount. So it depends on which GP I want. So GP, when the client goes to the GP, GP will decide, because GPs are also trained to psychiatric disorder. So if they think that they can be treated in the community, so they will prescribe the treatment. They can refer the client to the psychologist. They can refer to the client to the community facilities available. And if the GP thinks that the client needs to be seen by a specialist psychiatrist, so that they will write a referral letter to us to admission into a private health clinic. So we get patients from the community services as well. We get patients from the psychiatrist in the community. We get patients from the drug and alcohol services in the community. We get patients from the bed brokers. I think you must not have heard about the bed broker. Bed broker is a type of facility here. Like anyone looking for a psychiatric bed, they can approach the bed broker. So bed broker, it can be approached by GP. Bed broker can be approached by the public health. Bed broker can be approached by specialists in the community. So the bed broker, what bed broker function they will do? They will have all the referrals from everywhere and put it into every private clinic, whosoever want to take this patient. So the patient will see that whatever is near to their home or what facility they think is best. So they will accept the admission in that facility. So that's the bed broker role, that they, if anyone in need of the bed, they are the one who can find the bed for you. And then the general health hospital also, like we say that when the client is suffering from the physical health, they do have a mental health need as well. So if they think that somebody in the general hospital has a need of psychiatric facility, so we do get referrals from the other hospitals as well, general hospitals. So like when the patients comes to a private mental health facilities, so what is usually done is the assessment and treatment of mental behavioral disorder. When we come to the behavioral disorder, because private hospitals are not as restrictive in admission as the public hospital. Public hospital has very limited amount of the bed, but the private hospital has enough beds here according to the population. Because patients do have a private insurance, so there is not much restriction admission into a private hospital or a clinic. Because anybody who is not coping due to their environment, due to the situational crisis, anything detoxing, they can admit into the private clinic. But it is like a subacute type of facility. We don't, most of the private facility don't take the acute cases. So we only deal with the subacute cases. Like after the public hospital, when the patient was acutely ill, patient has gone to the public hospital, but still not ready to go to the community. So they will, after the discharge from the public hospital, and they will be coming to the private hospital if they are having the private insurance. So mainly it is the subacute. So when the patient comes to us, they will be referred to the psychologist, social worker, occupational therapist. They all are there in our clinic, exercise physiologist and the dietitian. We do provide the treatment like medications, ECT, and the TMS. TMS, I don't know whether it's very common in India or not currently, but here it's very common treatment for depression. It's the transcranial magnetic stimulation. It is a non-invasive way to stimulate the brain to treat depression. So it is still under the trial, but it's under the trial, but it shows that there is 68.4 success result with the TMS in lifting the depression. And all private facilities has TMS treatment here. Then when the patient is here, we do inpatient groups, like the groups are conducted by psychologists, social worker, so activities group, exercise group. Our therapists take patients for walks and they play with the patients. So all these type of therapies are available in the wards. we do have like a organized group program for the people with certain disorders, like here mainly the dealing with the traumas. So the inpatient groups are like emotional management program is there for 4 weeks. Patient has to come to the private hospital to admit for 4 weeks to attend this program, emotional management program, like when the patient can't able to cope, they are dysregulated in their emotions, they have not effective coping mechanism to deal with the environmental stress, community stress, and financial stress. So this is the 4-week program which will equip them with these all coping skills and mechanisms. Then there is a EMDR. This is eye movement desensitization and reprocessing program. This is done who the patient with PTSD. So this is all inpatient program. All patient has to come for 4 weeks to admit into the psychiatric facility to attend all these programs. And there is a schema programs. The schema is it based on the set of beliefs which are embedded from the childhood. And when it shows into your personality and the coping skills. So when they are ineffective and they are emotionally dysregulated, so this program helps in how to cope, how to recognize their emotions, how to recognize their coping skills, how to keep themselves safe. So this is the program which is mainly focused on. And there are the detoxes programs are also there. Alcohol and other drugs are also high in Australia. So there are 28 days detox program also we do for the alcohol and the other drugs. So as the patient get discharged from the hospital, we do provide also the outpatient groups, like, because to keep and watch on them, then how they are recovering, how they are going after the discharge. So there are the outpatient programs as well, like DBT, CBT, program for PTSD, programs for OCD patients, acceptance commitment therapy, anxiety management therapy, pain management, the issues with chronic pain. Schema is also done as outpatient as well, and creative mindfulness. So all our patients and all these programs are covered by their private insurance. So we have a high number of the patients coming for outpatient programs as well. Then we provide the outreach services as well. As once the person is discharged from our facilities, the outreach clinicians will go to their house or the community setting where they are in to provide the therapeutic support, enable people to recover at their pace, their medication management. They will observe early warning signs of the relapse, improve coping mechanism, and if the client require refer to other services, they can also do that. So these are the services provided by the like my clinic as well as other private clinic in the area. So regarding that, madam says that regarding the nurses. So nurses are also like provided with vast facilities if their mental health needs to be improved or they need, like in our private settings, like if somebody is not coping, have a high anxiety, so from the clinic side, we can have a free counseling psychology sessions, anything like 3 initially, but if you require more, you have to take permissions from your general manager and they can take as many as we want. As well as there is like, it's very common here, the person suppose after the psychology sessions, it's not improved and persons like to take. So there is a work cover as well. So work cover means you can apply with the medical certificate that you are mentally not coping. Then you can go for work cover as long as your treating psychiatrist thinks you requires the less, and it will be all paid. Everything will, it may be for 2 years, even for 3 years, it will be paid till the time you recover and your psychiatrist says you are ready to go to the work. So this is the amount of support we get here. Yeah, if we are in need of that.
Thank you so much, Sangeeta. It is so nice hearing about the mental health concerns, issues. Yes, when we are going towards developing the mental health issues are going to increase, but at the same time, it's good to know, and it's, I think, an eye-opener for us how in India we need to look at different models which are there in different countries and strengthen our mental health facilities. We have, experts like Madam Tanga, Madam Captain Sandhya, and I can make out that they're all looking at the test. How are we going to strengthen these services in our setup? And I'm sure Dr. Sai Lakshmi also has a lot of experience, and she's sitting at the National Institute. These things will be all a good learning for all of us. Thank you so much, Sanjita. Now may I request our next speaker, Nikita Sharma, to talk on what is the status of mental health facilities at community in Australia. Over to you, Nikita.
Thank you so much. Thank you for having us at this great initiative. It's very, very lucky to be a part of, virtually surrounded by such passionate people in mental health, and I guess, passionate for change. So it's great to see, and it's great to be here. I would like to share my screen to show everyone. All right. So I'll be talking about the community mental health services. So I've been working as a senior mental health clinician for a number of years in a primary health network. So just to give you a bit of an idea how services are divided in Australia, there are a number of community services, but they're funded differently. So there are statewide government services, so they're more sort of public health. So you're looking at emergency departments, they're outpatient clinics, so anything that's sort of related to hospitals. And then there's also federally funded. So this is more nationally funded organizations. So that's one of the organizations that I work for. So when we're looking at primary health, there are about 32 primary health networks across Australia. The reason why we are funded as organization is actually to look at the gaps within the services. So we look at the services that's already existed in the public system. We have been provided with the data of each community area. So where the risk factors are, who is our target group, their cultural background, their socioeconomic background. So we look at all of this data and we look at what's missing for our data group, and we fund those services. So this is, when we talk about funding services, it's not done at a very easy level. So there's a huge, tender that goes out, and community organizations will apply to that particular tender. It could be a $1 million, that we're looking to, fund those services, and those services will, or those community organizations will apply, get that funding, and will run those services for a number of years. And then we also look at that data of how many patients or how many people actually access those supports. So it's quite comprehensive, and how this money is actually distributed. And essentially it is taxpayers' money. So we do look at this very, very seriously. There are also not-for-profit organizations. There are a number of them in Australia, and they run a number of face-to-face, online, telephonic mental health supports for people in the community. There are obviously private hospitals that Sanjita mentioned earlier, and there's also area councils that look at mental health services as well. So it's quite vast majority of services that are offered here at quite a, from a different levels as well. So this slide may look quite, I guess a lot, but I just wanted to mention how the services are really quite widely spread out, from looking at quite early interventions to, supporting people with quite severe mental illness as well. In Australia, I think, I've grown up in India until the age of 14, and I moved here, and I've grown up, kind of completed my high schooling here and my nursing career here as well. So I feel that I've seen the difference, and how in schools, the talk of mental health is very, very common. And there is much, the stigma is definitely there, but there is much less stigma. There is that presence of, a mental health worker within the schools as well. So there is a very important, and there's big emphasis on early intervention. So even if people start to have a mental health concern in their life, there are a number of supports that are available. Australian government has funded a number of digital, online health programs. So even if you're having stressors in your life, you can jump online and access these self-help groups. You can complete a course that gives you a bit of an information what's happening with you, gives you some strategies to cope with your mental health at home. So and they're quite, vast majority of supports that are available targeted to specific disorders as well, not just day-to-day stresses. There are a number of digital health apps as well that, a number of fund. Just to give you an example, people who are dealing with alcohol misuse or alcohol abuse, there is a particular app that, you can just log on, and it's all paid for. You can just put in the area code that you are living in, and it kind of gives you the access of people who are having alcohol abuse issues, and you can have a chat, but it's monitored by a mental health worker. So there's no other, risk associated with it. But if you feel that you need to speak with someone, you can just tap on and actually speak with someone over the phone, or actually have a face-to-face session as well. There's a very recent emphasis on people who actually have mental illness, and how incorporating these individuals within the mental health system will reduce the stigma and people accessing more support. So there's often a use of mentor-based services. So if people are having some mild mental health issues, they can actually get a coach for 6 weeks, which will help them guide them in whatever they're needing support with, and refer on to other services if they're needing longer term support. So when you're looking at in the community, Sanjita earlier mentioned the GP. GP is a general practitioner, which is your local doctor. Often people here have actually got a general practitioner, and their first point of contact is them, and GP will refer them to a private psychologist, so they can actually get a mental health treatment plan. So anyone's allowed to get a mental health treatment plan. You don't need an age restriction, and you can get your private 10 to 18 psychological session, in the community, or can actually get a referral to a psychiatrist for more of a diagnostic picture or medication review and things like that. So everyone has got this access. In terms of psychologists, there is that free support as well, but people do sometimes access more psychologists that does have a little bit of a charge if they want to see them for per session. So in terms of community health organizations that I work for, it's the community primary mental health. So in the community, there is head to health hubs. The mental health hubs have quite a multidisciplinary team. So where anyone of any age can actually access all of these allied health workers, so psychiatrists, mental health nurses, psychologists, occupational therapists, and social workers. So there's quite a wide variety of people who you can access at a given time. There's also headspaces, which are targeted more for people from the age of 12 to 25. And Headspace itself has their online chats available. They also have, the multidisciplinary team within the Headspace centers as well. So I can't remember the exact number, but they're widespread throughout Australia. There's also, as I've earlier mentioned, that there's presence of school counselors, well-being coordinators, and school psychologists as well. So they will see a child in the school and for their interim sessions. But if they feel that the family and the child needs ongoing and more intense level of support, they will refer on to more intensive community support. In the public health system, as Sanjita mentioned earlier, there is a psychiatric triage phone, which is available 24 hours and 7 days a week. So it is available to anybody according to the area. You can call and discuss your concerns, and they will make that assessment that if an individual needs to attend the hospital or can be managed in the community. So there's crisis assessment team. There's a PACER team as well, which comes with police attendance. So if someone's either severely intoxicated or is at a risk of themselves or harming someone else, a mental health clinician and police will attend to assess, where is that client and their needs, and what treatment needs to be provided. Often clients who are discharged with a mental health unit, there's data which clearly depicts that people often will either reattempt suicide or severely deteriorate in their mental health once they're discharged from hospital. So there is a brief intervention team that offers them about 3 months of support to make sure that the client has a seamless discharge back into the community and back into their day-to-day lives. There's also community case management, which is more for the severe end clients, either with longer term mental health illness and significant psychosocial stresses. So the community case manager will be involved with the patient, their family, their carers for a number of years to ensure that they are okay. And once the risk does subside and the client is able to manage on their own or with some supports in the community case management will discharge. There's community care units as well for individuals who have severe mental illnesses and they lack basic skills in their life. So community care units will have these patients and help them have cooking skills, reading skills, learning skills. So it is quite a advanced clinic, and you can the individual can actually stay there for a number of years to be able to learn those skills that some individuals may lose either because of their trauma or their life incidences. So there's quite a great unit that's also available for people who've missed out on basic skills in life. There are also specialist mental health services, so I guess there's targeted support as well. It's not just the generalist supports that's available. So there's eating disorder clinics in Australia. There's also an organization called Spectrum. So this is Spectrum is one organization in Victoria that every person can access, and it's targeted towards people with personality disorders. They look at the management plan. They look at the individuals who are presenting to the hospital over and over again, and they come up with a treatment plan that ensures their risk is managed, and that there are a number of services that are involved with patients who have got a high risk. There's also perinatal mental health services and drug and alcohol services, and there's a number of units that are available for people to access. And there's also a big emphasis in services for LGBTQI community as well. So there's counseling for support and groups, and there's also National Disability Insurance Scheme that's been funded by the government in the last number of years for people who have got a disability that does impact on, or mental health impairment that impacts permanently on their life. So people can actually get a funding. It could be that they get $40,000 annually. They get a person to manage this $40,000, and that person will ensure that person's got home help. They've got access to the dentist, access to social worker, access to groups and things like that, just to give you an overview. So with mental health, there's often psychosocial stressors. So there's not just mainstream mental health services that are available. There is also a vast variety of services that are available for people with mental health disorders. So there is supported residential accommodation. So if someone's got a mental illness, they have got this option to go, and there are a number of them available throughout the community. There's housing support, there's legal services, there are financial supports and carer support. So there's a huge carer emphasis here. And we understand that there is definitely a carer burnout in the community, and especially it was increased during the COVID-19 pandemic. There's also advocacy services. So if people do lack the ability to speak up for themselves or have make sure that their rights and responsibility are maintained, there's also, you can get an advocate here who will make sure that your concerns are heard. And there's also respite care as well. So people can actually, for 2 weeks that they can admitted in the respite care to get a bit of a break of their day-to-day life in their home. So there's a number of telephonic services available. So people have got that access. They can pick up the phone and speak to a mental health professional. So there's Beyond Blue, there's Lifeline, there's Suicide Callback Service, there's Headspace. Butterfly Foundation is for eating disorder. Respect is actually for people who are having domestic violence issues. There's Nurse on Call, that's 24 hours. There's Parents Online, so parents who are in distress, either they have got concerns for themselves or their children, they can call this helpline. Kids as well can call a line here and speak to a professional. So this is something that is, quite, I guess when we talk about access, that kids actually can access services here. And there's also Men's Line as well. So in terms of my role in the community, in response to the COVID-19, there was an increased, number of referrals and a significant gap in services what they could provide at the time. In response to COVID-19, there was Head to Health hub started, and to reduce the challenges of the gaps and reduce the gaps in the services, the government introduced an initial assessment and referral decision support tool, which looks at these wide number of domains. So we look at the symptom severity, the risk of harm, their overall functioning, their coexisting conditions. So we look at all of this data to be able to make sure what stage do they actually fit in. So it's kind of go from 1 to 4, and then on basis of this staging, we look at what services do they actually fit in, and so they can have either 1 or 2 or number of services can be referred to for their ongoing treatment. So, this is kind of like overview of what mental health, services are all about in Australia. In 2019, there was a huge Royal Commission that was conducted as well. So looking at these services, you may think that Australia is, very much, influxed with all these mental health services. 2019 Royal Commission highlighted that there are a number of gaps in the services. The system was essentially failing, which is why there's been an increased funding in the mental health workforce, supporting nursing staff as well, extension of beds and whatnot. So we're seeing a lot of that funding now come through in Australia. Thank you, everyone.
Thank you so much, Nikita. It is so nice hearing from you what all is happening in community setup in Australia. And it is definitely a big learning for us, because we often come across different cases, and a lot of people now, people are overcoming stigma, and they do talk about mental illness, and they are looking for services, and they're getting confused where to go. They're not very sure about how to avail those facilities, but we could see a very good picture of Australia, how the services are organized. And I'm sure that all the big shots who are sitting over here, it's a big learning for them. It is book learning for us, and we can always work for how we can improve the mental health services in community in our country also. Now we have, thank you so much, Nikita. It's nice hearing from a young person, such energetic one. All the best. Dr. Sai Lakshmi, we move on to you. And Dr. Sai Lakshmi is the one who has worked intensively in the field of mental health. We have already had her introduction. I know Madam is waiting since long. She had to move out for some other work, but she stayed back. Thank you so much, Dr. Sai Lakshmi. We would like to hear from you, what are the strategies which are there to empower psychiatric nurses in India? And also, what is the community services which are being provided in our country? Because NIMHANS is the one which started with the community mental health concept. And when we went as students in early 80s also, they were so well established. Over to you, Dr. Sai Lakshmi.
Yeah, thank you, Dr. Raminder, for this. Am I audible?
Yes, ma'am.
Okay, I'll just share my slides. Is my slide visible?
Yes, ma'am. Yes, ma'am, it's visible.
Okay. So, good evening, respected Dr. Deepika Kaka, Nursing Advisor to the Government of India, Professor Raminder Kalra, from ANEI, the President, Mrs. Tangam Gomez, Captain Sandhya Shankar, the Delhi chapter President of ANEI, and my co-speakers, Ms. Sanjita, Ms. Nikita, Ms. Rachel, James, and all the virtual audience. Good evening, everybody. and I'll try to keep this presentation brief. I'm going to talk more about what we are doing at NIMHANS for empowering psychiatric nursing, the various academic programs that we are running. So we have MSc in psychiatric nursing, diploma in psychiatric nursing. We have also started community mental health nursing fellowship in geriatric mental health nursing, and neuroscience nursing. We have MSc and diploma. So our neuroscience nursing students also get an opportunity to visit the psychiatric side and learn more about psychiatric symptoms, because we know that these symptoms can surface in patients who have neurological problems too. The entrance criteria for PhD nursing would be MSc in nursing of any discipline. And this is actually advantage for us. We haven't restricted it to MSc psychiatric nursing, because we felt that after an exposure to the work at NIMHANS for 3 to 5 years during the PhD, and the PhD in NIMHANS is more of clinical work oriented. So the students who have done MSc in med-surg nursing or OB-GYN or pediatric or community health would have a very good exposure to psychiatric nursing, and would be able to later apply this when they come across mental health issues in their respective discipline population too. And it was with that intent that we kept this criteria for PhD nursing. So I would like to also talk a little about the clinics which we are running as nursing faculty. So this is after I became head of the department in 2017, I had encouraged my faculty to start clinics. I'll take it later. Sorry for that. To start their own clinics. And this is one way of using the expertise which we have learned in our own discipline of psychiatric nursing. So this is Dr. Prashanti Natala, who runs a substance abuse free existence services in the NIMHANS Center for Wellbeing. And you can also see our director, Dr. Pratima Murthy, who is actually an addiction medicine consultant. And the other person standing is one of our nursing officers who has joined in this initiative. We also have another nurture clinic by my other faculty, Dr. Radhakrishnan, who is a nursing consultant in the child and adolescent psychiatry. So this clinic runs in the child and adolescent psychiatry OPD. So our MSc students, PhD students, and the faculty run this clinic, and they see children and try to address various concerns, physical health concerns to parenting, positive parenting, to mental health issues too, and counsel based on the requirement. And these are some services which I am running as a nursing consultant in the psychiatric rehabilitation services. The recovery oriented services cafe, which looks at strengthening the instrumental activities of daily living skills of people who have mental illness. It's a self-sustainable model involving people with mental health issues as well as their family caregivers, and also looks at providing healthy snacks, food. So it's actually a very popular cafe which has consumers from staff, students, and public too. And some patients have also got employment out of this. So that is one clinic, and also offering holistic health counseling in the psychiatric OPD, adult psychiatry unit. So we not only give counseling in the OPD, but also through telemedicine, reaching out to patients who are not able to travel, maybe far northeast states of India, as well as in the wards too. So we look at counseling on weight management for patients who are taking antipsychotics because they are prone to developing metabolic syndrome. So we calculate the BMI, and this is recorded, and we also show the patient the next time when they come if there are any changes based on if they have followed the counseling which was given to them. So it's very scientifically based. And also counseling on medication adherence, sleep hygiene, the family emotional climate, and various other issues such as social media, healthy use, and so on. So 227 patients we have seen. There are many PubMed indexed publications which have come out of this venture. and one MSc thesis and one PhD thesis too. Apart from this, we also, why I spoke to you about those initiatives was to show that as psychiatric nurses, wherever we are, we can do our might, something innovative, something different to help psychiatric, patients with mental health issues, and also to use what we have learned effectively. So beyond this, we also reach out to Karnataka DMHP nurses through telemedicine sessions. We have monthly case discussions with them. The case discussions are either patients whom they have seen, and they would present the patient to us and also discuss the problems which they faced, and also if they had any solutions to address those problems. We also have case discussions. It is our MSc students who present patients whom they have seen. So there is a very healthy learning exchange which happens. We learn from them, they learn from us. And this is one way of empowering the psychiatric nurses through telemedicine. So these are some projects which we got in various states, in Bihar, in AIIMS, Rishikesh, where we tried to, where we trained nurses in the district mental health program. We have also developed a smart nurse app which can be used on the Android phone, and the person who is using it will be able to get information about various common mental health disorders, which they would identify in their patient when they were in the field. The NIMHANS Digital Academy is another initiative. It started in August 2018 after it was inaugurated by our president of NIMHANS, the Union Minister for Health and Family Welfare. So we have a diploma in community mental health nursing course, and this is the 15th batch which is currently running. So 271 people have been certified in this so far. Nurses from any discipline can join. It's a 6-month course, and again there are a lot of apart from didactics, there are also a lot of case presentations, case discussions, some assignments which they have to complete. We have also developed standard operating procedures in psychiatric nursing, and along with nursing audits for these, and these have been published in an enhanced publication. So this is in the facilitator manual for nurses. I had an opportunity. I should thank Dr. Rati Balachandran for giving me this opportunity in the National Emergency Life Support Manual. I was actually surprised that many did not look at psychiatric emergencies as an emergency, but we're looking more at other emergencies, stroke and traumatic brain injuries and so on. But no one would even consider psychiatric emergencies. So it was surprising to me, and luckily I had the opportunity to be part of this, where I could introduce psychiatric nursing emergencies too into this manual. So I'm very grateful for that opportunity. And from the Department of Nursing, we have also looked at, we all are aware of the health and wellness centers from the Ayushman Bharat, which has come up over the past few years, and also is a initiative of our Prime Minister Modi ji. So here we know that the BSc nursing students have an opportunity to be community health officers, and that is why the Indian Nursing Council also had, in its very recent revision of syllabus, introduced a lot of changes, especially in community health nursing, to prepare them to be middle-level healthcare providers to take up these designations. So these are various manuals in which we had contributed. So mental, neurological, substance use disorders, care at health and wellness centers. So manuals for community health officers, for nurses and staff nurses, for multi-purpose workers, and for the ASHA level workers. So you'll find these in the Ayushman Bharat website. So this is another way of empowering the psychiatric nurses. We have also prepared clinical schedule for psychiatric nursing. So Dr. Radhakrishnan's PhD student had taken this as his PhD work, and the version 1 was released, and we are waiting for the next version 2. So this gives a very clear step-by-step guideline for nurses in the primary care, how to assess the patient, how to intervene, how to refer these patients, how to raise, spot red flags, and then refer these patients. So this is about the COVID-19 pandemic. I'm sure that all the mental health nurses here on this platform would agree with me that psychiatric nursing has been treated as a perpetual Cinderella. We have always been sidelined, and this is actually the pandemic is a platform where psychiatric nurses could use what they have learned to offer psychological help for all their colleagues and other healthcare providers. So the PsyCare platform was an initiative of the Department of Clinical Psychology at NIMHANS, and where I was also a member. We could offer psychological help for nurses also who sought help on this platform. During the COVID pandemic, again, we had conducted many CNE sessions and prepared many videos, demonstration videos to address mental health issues also. So this was another opportunity that we got. And I'm very grateful to the WHO India for having funded Trainer of Trainers program on promotion of mental health of healthcare providers. So I had co-PIs from the Department of Clinical Psychology, and we worked with the Ministry of Health and Family Welfare Nursing Division too. So the outcome of this was 450 master trainers with psychiatric nursing discipline background, who in turn trained more than 2,000 nurses from 25 states and 4 union territories of the country. And we had also prepared self-care manuals and mentored CIP nursing faculty, CIP Ranchi, to continue this training in Northeast states of India. So this is the manual that we had prepared, mental health self-care manual. Professor Tangam was asking what help, what support is there for our nurses. So this is what we tried to do during the COVID pandemic, but this book is useful in any situation, any emergency crisis situation. It's not only for the COVID-19 pandemic, and it's a very useful book with a lot of demonstration videos. It has soft copy, a pen drive too attached to this, and it has been already disseminated by the WHO India to all the nurses who participated in this program. So we also receive external students from different parts of the country and also from other countries like Nepal, Bhutan, Burma, London. So nearly 4,463 students over the past 4 years. And they also get some psychiatric nursing training here in the department. We are also looking at Oslomet, Norway, students coming. We are going to receive them in 2023 for a 3 months period to give them psychiatric nursing training. And we have an MOU with this university too. So this is a bird's eye view about what we are able to do for psychiatric nursing from NIMHANS. Coming to the second part, what Professor Raminder had raised was community mental health services. I can speak about what we are doing at NIMHANS. So here the approach is multidisciplinary team approach. We have nursing consultant, we have psychologist consultant, we have psychiatric social work consultant, and the psychiatrist. So it is a multidisciplinary team approach, and each discipline comes with their own expertise for the common benefit of the patient, the family, and the community. And earlier, before COVID, they used to reach out to patients through the neuropsych extension camps, satellite camps, conduct camps in the community, and assess patients, give them medications, counseling, health education, etc. And school mental health camps also were conducted. And we have urban community mental health centers in the NIMHANS Center for Wellbeing. So someone was, I think Dr. Deepika Kaka did raise the problem about stigma, that we can't talk about mental health issues. It actually becomes a sort of a hush-hush topic where we don't talk about even if we are depressed or feel low. So this center is situated actually in a residential place to destigmatize mental health, so that people, especially youngsters, feel comfortable in coming here for services. So there are many services in this center from all the departments of the behavioral science, from psychology, social work, and from nursing too. I had told you earlier, the SAFE clinic, Substance Abuse Free Existence Clinic, is run here. We also have a nursing officer who is conducting gatekeeper training for suicide prevention. And over the past more than 8-10 years, this service has been going on. So that's in the urban community. And over the past 4-5 years, the community mental health team at NIMHANS has tried to strengthen DMHP in various states through telemedicine. And they have also empowered them to continue this training to other states too. Also, NDA, the NIMHANS Digital Academy, has been of great value in reaching out to those whom we cannot reach out to usually, the unreached people. And through NIMHANS Digital Academy, we have been able to reach out and offer community mental health services in various parts of the country. Discussion of patient case discussions with MBBS doctors who don't have the psychiatry expertise, but still they are able to discuss these patients with our doctors through the NDA and continue to give better care wherever they are. So Telemanus is something which was inaugurated on World Mental Health Day this year 2022 here at NIMHANS by the Governor of Karnataka, and NIMHANS is the nodal center for this initiative. So Telemanus is reaching out to various states and helping people in various states when they access this helpline to connect to the mental health services which is closer to them. For example, if someone in Assam reaches out to the Telemanus center at NIMHANS, they would be immediately, the call would get diverted to a DMHP close to them. So this would help them to, get quicker psychiatric services, and also based on their own language and cultural background, someone would be able to better address their needs. We all know that this is very important, that you try to understand a person based on their cultural background. E-Manus is the same services, but through the digital mode. So that is actually a small part of what is being done at NIMHANS. And I would like to conclude with this, telling that I think that every psychiatric nurse should come to the forefront and ensure that mental health and well-being of the community is preserved. I would like to thank once again Annie, the principal and faculty of Holy Family College of Nursing, co-speakers, and the virtual audience. Thank you very much. If there are any questions, I would be able to take them too.
Thank you so much, Dr. Sai Lakshmi. It had been a real pleasure hearing from you. There's a lot of work going on in a vast country like India also, and I'm sure that NIMHANS is one of the pioneer institutions in this field to develop a lot of things. It's nice to hear that even the psychiatric mental health clinics run by the nurses have started so actively being functional. It's good to hear about case discussions being a part of learning, which is being done in many other places also. And one thing more, that Telemanus, which goes into the local language, is definitely going to be of great help to all the people across the country to get into the mental health facilities near to the place. Thank you so much, Dr. Sai Lakshmi. And that's the time to hear from Madam Rachel about what is happening in UAE. Are the services easily accessible? Are the people really coming out to avail the facilities? And how the things are growing in the field of mental health in UAE? Over to you, Rachel. Rachel, you need to unmute yourself.
Good afternoon, everyone. It gives me an immense pleasure to be a part of such respected speakers and great audience. I have to heartily thank Professor Ravinder ma'am for inviting me with such a great speakers. And it is my privilege to speak here to highlight some issues which are here in UAE and what all are the services provided in the UAE. The thing is, actually, when I saw all the services provided in other parts of the world, we might be still, we are taking the baby steps. Is my screen visible?
Yes, Rachel, it is yeah, it is, we can see.
Okay. So today, as I'm going to tell you about the mental health issues and services in UAE, just to have a little background about the UAE itself, or the UAE is basically mainly embracing scientific progress in every aspect, especially when it includes health. Now, we had certain studies also which had basically focused, or which had shown that the government of UAE is also working collaboratively to effectively improve the public health condition in the state, with special focus on the non-communicable diseases and mental health specifically, if you'll say. Now, when I'm saying the issues itself, we had been, we have certain studies where it has been shown that basically depression associated with anxiety is the most common issue found in UAE. However, there are other psychotic, common psychiatric disorders are also there, like schizophrenia, bipolar disorder, personality disorder, intellectual disability, and substance use disorder. Here, basically, females have shown more mental health issues rather than males. And the peak occurrence of the psychiatric issues are seen among 45 to 54 years of age. However, it may differ based on the category of the mental health problem a person might suffer from. The most common issue, as in a nutshell, if I would like to share about UAE, is the stigma itself. Now, as all of our speakers had shared about the different stigmas the people are having here also, one of the most important area which has to be still dealt with is the stigma. So there are different types of stigma here. If I'll say, like, even accepting the mental illness itself is a huge issue here. Some of the hospitals, if you'll see, there might be, it is still not an easy way to just to express that, okay, we have a psychiatric illness, or someone is, they themselves or someone in their family is going through a psychiatric illness. When we see other areas, or like other places, we have a lot of freedom as such. Here, when we see the studies show very widely, the youth here are specifically suffering from the depressive symptoms. And in the recent studies of 2020, the adolescent also showed the prevalence of the depressive symptoms. Now, when though the psychiatric situations or the services are not as per how we see in other parts of the world, but still this, when we compare from the past years, UAE has improved a lot. During the COVID times, there had been huge efforts made by the UAE government, as they had released a program called Hayat program. So Hayat is actually an Arabic word for life. So this was a mental health support which was given to the federal government employees, especially to deal with circumstances and anxiety which was associated with COVID-19. There had been mental health support lines and helplines were launched during this time. Also, there had been a national campaign for mental support, which was the National Program for Happiness and Well-being. We have the National Policy for Promotion of Mental Health. So this policy of promotion of mental health in UAE identifies the main 5 strategic objectives. So they are basically enhancing the effectiveness of the promotion of awareness of mental health, developing, strengthening and expanding comprehensive, integrated, and responsive mental health services for patients of all ages, strengthening multi-sectoral collaboration to implement mental health promotion policy, promoting the prevention of mental disorders for people of all ages, and strengthening capacities and improving information systems and conducting mental health research to develop their services. So in a nutshell, the national policy for the promotion of mental health basically includes the provision of mental health services to the outpatients, the development of mental health units for inpatients in mental health hospitals, and the establishment of community mental health services, including outreach services, care and home support services, and community rehabilitation. Now, as the mental health itself has been evolving, even here it has improved compared to the past years and compared to the other GCC countries. UAE government is regularly undertaking new measures, especially to address mental health issues, to reduce the stigma associated with it. So it has, the government has come up with many initiatives, especially for the Emiratis and the expatriates, by giving them the access to mental health services and support as required. However, even the government has started the new initiative of educating about the mental health and the issues in the school curriculum, which was not there before. In early 2019, the Ministry of Health and Prevention, MOHAP, also announced the launch of a number of digital solutions based on the technologies in mental health and psychological field. So which will be basically leading to the quantum leap in the clinical practices field. These digital solutions, it basically includes treatment by using virtual reality technology to help understand schizophrenia and to learn more about the suffering of patients with these diseases. So, and this is all basically done through the use of gear by Oculus technology. And here still, they are working on these areas. In addition, MOHAP also represented by the Specialized Care Department of Hospital Sector and in collaboration with Sharjah Roads and Transport Authority, that organized awareness lectures in English and Urdu to raise Sharjah taxi drivers' awareness about mental disorders. There had been a medical team from MOHAP that conducted examinations for 100 drivers to assess their acquaintance with mental disorders, its causes and treatment. The team distributed mental disorder related brochures, including how to control these disorders and the places where drivers can go for the diagnosis and the treatment. The mental health program at Abu Dhabi Public Health Center also aims in developing the projects and providing resources to promote community mental health and reduce self and social stigma around the mental disorders and associated treatment. Also, just to support the spreading of awareness of mental health, to reduce the stigma and to end the discrimination against those with mental illness within UAE, we have a very famous foundation here, Al Jalila Foundation, that awarded 3 Emirati journalists the Mental Health Journalism Fellowship. So the fellowship basically promotes the publication of quality discussion around mental illness, encouraging awareness and acceptance to stigmatized hidden conditions. Now, we have a lot of, when we see the current services of mental health in UAE, we have Al Amal Hospital, which is considered as an EHS hospital, which is a 276-bedded government psychiatric specialty hospital that is exclusively dedicated for the psychiatric and addiction treatment in Dubai. And that is serving the population of not only UAE, but also other GCC countries. So currently, this hospital is having active 204 inpatients, which is basically having acute cases. There are acute wards, there are active progressive wards, there is senior citizen wards, there is detox wards, and there is forensic wards. In addition to that, there are community mental health services in that particular hospital, and there is child, adolescent, and OPD services are provided there in this particular hospital. Alamal Hospital, or I should say Alamal Psychiatric Hospital, is the first specialized mental health hospital in the Middle East to obtain the international accreditation of JCI. So this hospital has also received the international accreditation for the occupational health and the safety from the British Classification Authority. Now, this particular hospital is being considered as one of the largest hospital in Arab region till now for providing the psychiatric support system itself. So common services which are basically provided here are adult psychiatry, child psychiatry, psychiatry for elderly, addiction treatment services, forensic medicine, psychotherapy, counseling, referral psychiatry, daycare, psychiatry for mental disabilities, emergency psychiatry, family and internal medicine, dermatology, occupational therapy services, speech and communication therapy, radiology services, pharmacy, laboratory, nutrition services, central sterilization centers, and e-clinic services. So it is actually a very, like in short, if I'll say, UAE might be a very young country or place itself. Sorry. Are you still seeing my screen? Yes, sorry.
Now it is gone.
Yeah.
Yes.
So when I see the all other areas of like we see our India or we see Australia, so here in UAE it might be still they are still taking baby steps, but it is good to know that we have started to improve the mental health services here. Here, when we have the medical services, we are having insurance, medical insurances are there, but basically we never had insurance specifically for mental health. So here the government is even working for having mental, for like insurance related with the mental health itself. So the government is literally trying to improve the mental health facilities. And even the newest which has been there is previously only Alamal Hospital was the only setup which was providing the mental health services. But now even at the EHS itself, the Emirates Health Services have started training the other staffs from the medical hospitals of UAE regarding the mental health. So it is a big step from an Arab country to come up for mental health issues or dealing with mental health itself. So it was, in a nutshell, that's how the mental health is all about here in UAE.
Thank you so much, Rachel. We talk about globally talking about mental health issues, and we can see that, yes, the Arabian countries are also coming forward, and UAE is taking a lead in that. It's nice to hear that people are overcoming the stigma and the people are moving towards mobilization of the resources, and everybody, I'm sure, sitting over here is deeply involved into mental health. Their presence shows that they are deeply concerned, and it is a lot of input everybody has got, that we have many things to do. Whether we are sitting in Australia, whether we are sitting in India, whether we are sitting in UAE. Fine. We could hear from Dr. Salim or Lakshmi also, great ideas from Sangeeta, from Nikita, and Rachel, from you also. We could hear how the mental health is progressing. It's wonderful. Can we have, is there anyone with a question? Gina, Jennifer is raising her hand. Quickly, we'll take 1 or 2 questions. Yes, Gina. Gina, Jennifer, I can see you're raising your hand. Gina, will you like to ask any question, please? If not, Gina, anybody else will like to ask any question? all our speakers have talked in so much of depth. They are expert in their own area and everybody is putting in a lot of efforts. I wish we could have had more time to discuss. We thought of finishing up with 1 hour, but I couldn't stop even one speaker because it was such a learning from each one. I can see people, from Australia also who have reached their night time and waiting to go to the bed, but still sitting with full enthusiasm and a smile on their face actively. Rachel also, after the day's work, being with us, everybody with us. Dr. Sai Lakshmi had to leave for another meeting. It has been wonderful. Thank you so much. And over to Arshi.
Thank you so much, ma'am. Now I would like to convey my sincere gratitude to our panelists, Dr. Deepika Khaka ma'am, Sanjita Sharma ma'am, Nikita Sharma ma'am, Dr. Sai Lakshmi Gandhi, and our loving Rachel James, our ex-faculty of Holy Family. I thank you for enlightening us with your knowledge and experience and sharing your area of perfection with us. I would like to convey my special thanks to ANEI, Madam Thankam Gomez and Captain Sandhya Shankar for this great collaboration. Thank you so much. A special word of thanks and appreciation to our administration, teaching and non-teaching staff of Holy Family Hospital and College of Nursing. And now I like to extend my gratitude to all the participants for their patient listening and active participation. And above all, I like to thank Almighty God to make this endeavor a great success. Hope today's sessions were of great encouragement for all of us to uphold mental health services a global priority. Thank you so much.
Arshi, just one thing I would like to say to conclude, that our work doesn't stop here.
Yes,
each one with us has to think what is the next step. Let's not look at what organization is doing, what the country is doing, what ministry is doing. Let us all think that we are all practicing nurses, that how can each one of us contribute to improve the mental health across the country, with starting with small steps being taken by each one of us. Thank you so much.
Thank you, ma'am, for guiding us, for mentoring us for this webinar. Thank you.
Thank you, everyone. Thank you so much.
Thank you so much, ma'am.
Thank you. Lovely to see you all.